All right, well, good afternoon, guys. Again, my name is Rosa E. Aleman, and I am one of the faculty instructors for the HMAS program. HMAS stands for Health and Medical Administrative Services. And for those of you that don't know, we're located in the 4th floor, and we are towards the end of the hallway on the west wing of the building. All right, so then let's get this presentation. Our program, our department has 3 certificate programs and 1 associate's program. Okay, so today I'll be covering every degree plan that we offer in our department. Let me just point out to you that the 3 certificate programs are the ones on the bottom. It's a medical information transcription, electronic health records, medical coding specialist. Those are our certificate programs. Certificate meaning that those degree plans can be completed from 6 to 12 months, okay, and as short as that time. Our HIT, Health Information Technology program, that one's an associate's program, and an associate's program, you can complete it in 2 years. All right, we have a day in the life of HIM. For those of you that are not familiar with HIM, HIM stands for Health Information Management. And health information management is medical records. Okay, it's just a fancy name to put it in that way. Nowadays, you go to a hospital, and as part of the directory, you notice how you see other different departments listed. Instead of seeing medical records department, you're going to see HIM or Health Information Management department. Okay, and that's what it is. It's medical records. Okay. It's got its new rebranding from medical records to HIM because medical records in a hospital and a clinic used to be, and some of them still are nowadays, they're paper records. Okay. The government has approved a transition that has happened since 2004 for every hospital, every clinic, every hospice setting, every home health agency, any ambulatory clinic to go electronic, meaning that instead of having paper-based medical records, now the government is pushing for databases, for electronic health records, for any software, any product, any vendor that will allow us to still make use of the medical record information, but now in a computer environment. So that's what HIM is. Okay. And what I mean that the government has been involved is that the government has provided incentives to physicians and to hospitals in order for them to adopt a program, to adopt an electronic health record, to take their people, send their people over to training for the new software, for the new environment. And so, again, even the government is involved in this type of transition. These are some of our hot topics right now in HIM. We have release of information. Release of information is anytime that you need copies of your medical records, okay, perhaps your parents, or perhaps if you've been a parent and you have to go back to the hospital and request your child's birth certificate, that's where release of information is. Also, privacy and security. Privacy and security is a hot topic in our particular area because of HIPAA. Okay, the HIM professionals should be kept up to date and should be very involved with any HIPAA guidelines. HIPAA stands for Health Information Portability and Accountability Act. Okay, so that is one of our areas of expertise as well. Some of the other ones, you have coding and revenue cycle management. I will be talking about the coding profession and the coding degree that we offer here on campus in a little longer. We also have clinical documentation improvement, electronic health record implementation, quality data management, records management, and so many others. Okay. We have, it's been maybe about the past 2 to 3 years that our profession has encountered several changes in different areas such as these. Okay. And so that's why we need to keep ourselves to continue to, either acquire continuing education hours, just like nurses do, just like physicians do, or also perhaps retraining workshops or keeping up to date type of workshops or reviews. Where do we work as HIM professionals? We could work at hospitals. Hospitals would be the larger departments. And by larger departments, I mean, for example, a 500-bed hospital could house HIM professionals in the different areas that we just looked at a few minutes ago. Maybe as large as 50 employees in a department. Physician offices, clinics, third-party transcription services, even home-based self-employment. Okay, our medical coding specialist degree allows for the possibility of you to be able to work from home. Okay, and what happens with that is that your hospital, your employer, will equip you at your house with the security items that you may need for your hardware, for your computer connection, for your internet connection. And that one happens to be one of the major attractions for a coding program. Okay? That students are able to come into campus, work on their degree, and then perhaps land a job opportunity at a hospital, and I mean local hospitals here in the Valley, okay, as well as obviously outside of the state. And so what they'll do is they'll keep you in-house for about a year, about fairly enough for you to gain experience, and then they will send you home. Okay, they will equip you at your house. Obviously there's productivity guidelines, and there's still, you can't just go home and, watch TV or anything like that. You're working from home, but your productivity and your accuracy in coding is still being monitored. Also, educational institutions, research institutions, consumer organizations. These last couple of ones, those have to do because of the electronic health record. We are handling a vast amount of information within medical records. Records management means utilizing that data for research purposes, to be able to track trends in different locations. For example, let's say statewide. If someone's conducting a study regarding diabetic patients in Hidalgo County or Starr County or the border counties, and also to even identify statistics as far as crime, statistics in privacy, and so that's when we utilize that data and the documentation in the medical record, okay, either paper-based or electronic, for these other type of specialties. Okay. And then I believe I skipped third-party payers. What third-party payers are, they're insurance companies. Okay. And have you guys heard of Obamacare and the Affordable Care Act? Yes. Third-party payers are insurance providers, and within HIM, as HIM professionals, you get exposed to the different payers, okay, from Medicare, Medicaid, to Blue Cross Blue Shield, workers' compensation, disability claims, any Social Security Administration benefits, and our students get educated under those billing practices and procedures. And you may possibly be able to work for a third-party payer, okay, which is an insurance company. Okay. Especially because, again, of the demand with Obamacare coming in and more people trying to qualify for insurance benefits, okay, there's a demand for that. These are some statistics that are from early this year, January 8th of 2014, and our profession compared to other professions and the job growth that is expected within the next 10 to 12 years. Okay. I don't know if you guys can see, 19% is an expected job growth rate for RNs, 20% for pharmacy techs, and medical records and health information technicians at 22%. Okay. And so notice how they go in an upward scale, okay? Meaning that we have that demand, we have that necessity to educate people in the administrative aspect of healthcare, right? And that's where we come in, that's where our program comes in. So starting off with the certificate programs, this is number one, certificate number one, it's an electronic health record specialist. So then again, by now you guys are aware that physicians, hospitals, clinics are transitioning from paper to electronic health records, okay? And so how does that transition happen? Well, as an electronic health record specialist, you get trained here on campus for the computer skills in order to maintain that medical information in the system and the program that you're using and the software. Also, attention to detail is vital in this particular profession. The salary starts at an average of $40,000 per year, and the job outlook is at 25%. Okay, so again, keeping in mind the job outlook, the growth rate, okay, it's at 25%, which happens to be more than the average. This right here is a snapshot of the electronic health record that we utilize here on campus. Our students get trained on this database. It's called Spring Charts, and it's an electronic health record software where students get to book appointments, where they get to also book no-shows, where they get to check in patients, check out patients with a receipt, with a remittance advice, with a routing slip. They also get to track the patient tracker, which is the location of the patient as they transfer from the lobby all the way to where they get seen by the doctor, they get their vital signs taken, they get assessed by the doctor, and eventually up until when they leave the practice. Yeah. They also get to utilize the message center, which is an internal, think of it as an intranet communication system. Also, they get to enter different appointment dates in the future with the calendar, and then they also have a personal to-do list. Okay. So this is, again, just a quick snapshot. I wanted to show you what it is that our students use here on campus, okay, to get trained for the electronic health record certificate. This is certificate number 2, medical information transcription specialist. We have, they listen to recordings that physicians and other professionals make and convert them into written reports. Okay. What physicians do is they dictate their encounters for any pathology reports, any operative reports, any ER reports, or even radiology reports. Okay. And by dictating, I mean that they will manually use a device. It's usually a phone system, to where they record their speech, their dialect, their linguistics into a program to convert these into written reports. Okay. And so transcription is what they do is they type out these reports. Okay, they transcribe these reports. Right. Other reports include medical histories, discharge summaries, etc. Okay. Medical information specialists also complete other additional administrative tasks. Medical transcriptionists are actually having a role change. They're having a transition into becoming medical letters, and they will have a new name though. I believe the new name is healthcare documentation specialists. And they will transition into an editing role. So instead of just transcribing those dictated reports that the physician is recording, they will review the information from that transcribed report for accuracy and for consistency. Okay. The median salary for medical information specialists is $34,000 per year, or $16 per hour, and the job outlook is 8%. This is our third certificate. This is the medical coding specialist. Yeah. As a coder, as a medical coder, you assign numerical codes to diagnosis and procedures. Okay, these are the ones performed at the hospital or at doctor's offices. And as medical coders, our students get trained on the appropriate coding guidelines for inpatient and outpatient procedures. Okay, there's a difference between both settings and the way that these numerical codes are assigned. Okay? Here in the US, we have 3 different HIPAA mandated code sets. They are ICD, which is International Classification of Diseases. It's also CPT, Current Procedural Terminology, and there's HCPCS codes. Okay, those are the 3 that here in the US, again, we use for billing and reimbursement. Okay. As a coder, you need to have a very well-rounded background in medical terminology, in your disease process, your anatomy and physiology courses. You go through courses such as basic and advanced coding. There's 2 different levels. As well as pharmacology, pathophysiology. Those are also required courses. Coders are able to work at different types of medical coding and billing practices, but in addition to that, again, they're also able to work from home. Okay, that's one of the attractions to our program here on campus. We're looking towards the possibility of perhaps working from home one day. The job outlook is 20%. Okay. The reason why it's at a high job growth rate is because these type of professionals right now are encountering another huge transition. We are going from ICD-9 coding system to ICD-10 coding system effective October 1st of 2015, okay, which is next year. Nationwide, there is currently a shortage of certified medical coders. Okay. We try to encourage students that completing the curriculum alone is not sufficient. You shouldn't just settle for that. Our students, because we are an accredited program here on campus and here at STC, our medical coders and our health information technology students are able to sit down for examination via our association. Our national association is AHIMA, American Health Information Management Association, and that allows for them to sit down for examination, take a national exam, and be able to acquire their credentials. Okay. Credentials are important because they make you a more valuable asset to your employer, to your company, as well that AHIMA backs up your expertise, backs up your experience and your knowledge in that particular subject. Okay. The salary, an average for coders is $48,900 per year, or $16 per hour. But notice experienced coders could go up to $56,000 per year, and this is within 3 to 5 years of experience. This is our associates program. Again, we only have one associates program, and it's for health information technicians. Okay. As health information technicians, you actually have an overall background of privacy and security, of quality improvement, of billing procedures, of electronic health records, of health data, content and structure, and so you have more of a variety of knowledge regarding this particular associates program. Okay. This is a more well-rounded, that includes courses from the medical coding specialist, from the electronic health records, and the medical information specialist. The average pay for an HIT student begins or ranges from $34,000 to $56,000 a year. And again, the difference between these salary ranges has to do with your credentials. Okay, has the student tested for their examination? Have they passed their national certification exam. You know. Again, it's a national certification. It's recognized at any state here in the U.S. Okay. The job outlook for health information technicians is 22%. Our program offers classes mornings, during the day, evenings. We also have hybrid classes, online classes. We also offer classes in the summer. And our courses transfer within. From the certificate programs, for example, if you start off at the electronic health record, which is our shortest one, those courses are transferable into the coding certificate program. Let's say you want to specialize in coding. After that, you can do that. And even after you complete the coding certificate program, you can further transition into the associate's degree program with the same courses. You just need to take an additional completion of the curriculum for the associates. Okay. But they are transferable within. Right. This right here is actually a snapshot of our National Association webpage. It's AHIMA. And our students are eligible to become student members of this national organization. The membership lasts either 1 year or until you complete the curriculum that you're aiming for, whichever lapses longer. And I use these professional resources in my classes to keep our students up to date with articles, with notifications, with alerts. They also have resources via an electronic library, an electronic database that deals directly with HIM topics. In addition to that, they also have something called engaged communities, which are professional blogs, again with professional topics. And they're also on Facebook and Twitter. I am also, in addition to an instructor, I am also one of the primary advisors for the Health and Medical Administrative Services Student Club that we have here on campus. This is a picture that was taken just about 2 weeks ago for the Harvest of Health. We were showcasing a board with information for students. And we were passing out flyers and information with our degree plans. And these are a couple of my students. And we usually take this board because I get my students involved in doing student presentations for high schools when we get invited to their career fairs and stuff like that. And then this is another group picture that we took with Jerry the Jaguar, our school mascot. Our contact information is right here. Our department chair is Ms. Irma Rodriguez. Her room number or her office number is room 424. Mine is actually right next door to her. Our names are on the outside of the door. Our office hours are also displayed on the door. Again, my name is Rosa Leman. We also have Dr. Rosas as a full-time instructor, as well as Ms. Norma Longoria. And then we also have adjunct faculty in the evenings and weekends. Any questions?